Hi, I'm Cherie Lindbergh, and welcome to Elevated Life Academy, where we share real stories of healing, hope, and transformation. Tune in to hear how everyday people are rising above and lighting the way for others. Welcome to another episode of Elevated Life Academy, and I am your host, Cherie Lindbergh, and we have our guest today, Melanie Twite, and we are going to talk about trauma literacy for healers. And so I'll have Melanie introduce herself, where she's from, and then we're going to get into our conversation. As you know, these are spontaneous conversations, and we just see where we take them. So good morning, Melanie.
Hey, good morning, Sheree. Thank you. I'm so excited to be here with you. I am Melanie Twite. I am located in Meridian, Idaho, which is a suburb of Boise, Idaho. I have a private practice here, and I'm also a brain spotting consultant. And I work mostly with complex PTSD, developmental um, trauma, recovery from toxic relationships, whatever we want to label that. It's something that I've been doing without knowing it from the beginning of my career, but um, that's what I do. And then I have ethics classes that I teach, and then the trauma-informed brain spotting.
Yeah, would love to hear more about this because I remember when you started to design this and you were talking about how healers, that call themselves, trauma informed, and then you were finding out that there was a need for just your basic literacy and trauma. So can you talk a little bit about that?
Yeah, I think that what I really started to see probably over the last 11 years,
Mhm.
as trauma has become more in the forefront of our profession and a lot more people talking about it, I really see this word trauma informed kind of all over the place on people's profiles, as they're talking about what they do. And we don't have a lot of consistency in how we define that word or what it actually means. And so I really started looking at what people are saying. So they would say, like, if I went to go get trained in like EMDR or brain spotting, they're trauma informed. And there really is a difference between knowing a treatment modality that is designed to treat trauma and really understanding what trauma is and what trauma informed means. And he would kind of mix up trauma awareness with trauma informed,
Mhm.
that we're aware of it. And so it really affects like how we sit with our clients because we don't always understand what we are seeing, what they are experiencing, what their body is doing, where their negative cognitions come from, why they are struggling with their relationships. And so I really felt like it's important for maybe to create this cohesiveness around some of our terminology
Mhm.
and and especially trauma literacy. Right. So for me, I think sometimes, like when I go see a physician who was taught how to do stitches without taking an anatomy and physiology class,
Mhm.
I, I wouldn't because,
Mhm.
right? Because they know how to stitch something up, but do they know what they're stitching up? And so for me, with clinicians, we are basically taught how to do stitches, how to do trauma work without really understanding the neurobiology, biology, physiology,
Mhm.
of trauma. So.
Yeah. So what I'm hearing you say is that you wanted to go into the foundations, help them understand on a deeper level, because they didn't have foundation. They had all this knowledge, but they didn't have maybe like the why it's this way, that kind of thing. Is that what you're saying?
Yeah. So my degree is actually marriage and family therapy. And so I learned in grad school in the first part of my career about attachment, right? Attachment styles, family systems, dysfunctional family systems, all of those things that we see in our clients. And I realized those are my colleagues who had a counseling degree but didn't have the marriage and family, they were missing those components. Right? They weren't seeing those. And then I worked later with a neuropsychologist and started to learn about the brain. And um, she said something to me one time, and then this was like 2006, and I was like, that can't possibly be. But she said, Melanie, nothing happens separate from a brain function. And for
Mhm.
some reason, that statement was just like I couldn't comprehend it, but now I'm like, well, duh.
Yeah, yeah.
Right. Yeah. So, so some of those foundations we're just not taught. We're not taught in grad school. We're
Right.
not, there's not a lot of classes out there about trauma per se. And so I think the foundations help us be better clinicians and use
Mhm.
our modalities to their full capacity.
Mhm. It's almost like trauma, neurobiology, physiology 101 or something like that. That's
Yeah.
kind of
Yeah.
what you're describing. Yeah,
Hmm.
because, back in the day when I went to this is a little bit ago, um, we did not have a trauma class. And I know, I've taught some of the trauma classes, but even just one trauma class isn't really enough for the amount of trauma that's out there. Um,
Hmm.
yeah, do you know, is that something that is happening in grad schools, that they're expanding the understanding of trauma, or do you still feel people come out of grad school without having that knowledge?
I think that having any class at all in trauma is still the rarity in grad school. It's not the
Wow.
norm. The
Okay.
few I've done some research and looking just kind of looking at what grad schools across, the board teach.
Mhm.
And unfortunately, Cherie, like a lot of the curriculum is the same exact curriculum I
Oh,
learned 21 years ago. They the
yeah,
same exact classes.
yeah,
So
yeah,
there are a handful of universities that will have like a trauma class,
yeah.
but unfortunately, a lot of those are still focusing on events, right? Like war or natural disaster, or they're not focusing on interpersonal trauma.
Mhm, mhm.
Right? And
Yeah,
so, yeah, or they're an elective, or it's a 3 hour class, and it's just not enough. So,
right.
yeah, so that's this course is designed to teach, yeah, the the systems in which trauma occurs. So the family system, generational trauma,
Mhm,
community trauma, cultural trauma. So
mhm,
all of the experiences, the different kinds of trauma, right? Like there's
mhm,
different categories. Uh, the biology of trauma, like what's happening in our cells and our DNA, on epigenetics, how immunology, psychoneuroimmunology,
mhm,
ACEs, again, how it affects our health. So
yeah,
all of that is part of this course. Really, it is like travel 101,
mhm,
like
mhm.
how it shows up in our adaptive coping skills, and way beyond just, what is out there now, fight, flight, freeze.
Right,
And right,
right.
like
Well, I know it's only been the last few years that they've talked about fawning and I mean, there's so many Fs, fawning, fragmentation, all these,
mhm.
they're expanding the Fs of, yeah,
Yeah, yeah.
I see
But
what
what yeah. But what does that look like, right? And like in real time.
Mhm,
And so then we take that knowledge base, and the third part of this training is what does that look like when it's sitting in front of you, especially in brain spotting, right?
mhm,
What does that look like? What are you seeing?
mhm.
Um, when
What are some of your top surprises when you teach this class to folks?
I think that some of my top surprises is that we are still thinking of trauma as the event. We focus
Mhm,
too heavily on trauma being the event
mhm,
and not seeing the connection between those traumatic experiences, traumatic stress responses, and what we see physiologically and immunology and in the immune system.
yeah,
And that these coping skills, that we can't just think about them differently, right? We can't just teach them a skill.
right.
Right? Like I had somebody in yesterday that has been through CBT classes, DBT classes, and when they started to try to use all those skills, and they have
Yeah.
so much shame because they just can't use the skill.
Well, yeah, and they don't understand that they can't use the skills because it's not cognitive. It is in the central nervous system. It's an imprint inside there, and so until you clear it out of the neurobiology, you're
Mhm.
gonna keep hitting a block.
Yeah. And
Yeah.
I think one of the biggest surprises is that I believe that we still teach things backwards, right? That the goal of healing is to get your cognitive brain online so that you can be rational. And I'm like, that's not the goal of healing, is not to be more rational. The goal of
Mhm.
healing is to be more present and regulated in day to
Right.
day life.
Right.
It's, it, and so that people really still, even all that we know about trauma, still kind of have this view that we need to be more rational and that
Yeah.
that's the goal.
Yeah. Well, I mean, I'm just thinking of our Western culture and that we are sympathetically dominant, like go, 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 crash. And so being present uh, is, I think, something that a lot of folks don't even understand because there's a lot of unconsciousness out there.
Yeah.
Yeah.
I don't remember. Maybe you'll know who this quote came from. I think it might be Demasi, but I can't remember exactly. But it says, "We believe that we are thinking creatures with the ability to feel, and really we are feeling creatures with the ability to think."
That's
So
a great quote. I don't know who said that, but yeah.
I think it. Yeah, I think it's. Oh, I can't remember, but it's yeah.
Yeah.
So I think that's one of the biggest surprises, that we just don't realize how systemic, like our whole
Right.
system is
Right.
affected, not just our ability
Well,
to
and I
think.
would even say that there's a huge disconnection even between the regulatory boards that we face because there's so many people that don't understand the bottom up therapies and
Mhm.
how important that is, and that all this information, including trauma, comes into the body first. And
Yes.
then we tell a story about it, right?
Yeah, yeah. It's like the second part, right? Like the meaning making. Like you have the
Right.
experience that comes into the body, and then we have, trying to make sense of it, trying to make meaning out of it. But how do you make meaning out of something that's biological, right? That's
Right.
coming from your
Right.
cells and your nerves and not your thoughts.
Right. Well, there's this big boom out there about nervous system regulation now. Now that
Mm.
we're knowing more about it, and I'll admit I'm on that bandwagon too. But in terms of helping people know that the reason you're blocked or the reason you're struggling, just like what you were saying, is that you can't use your adaptive coping tools that you've learned if it's in your central nervous system and it's stuck in there, 'cause
Mm.
it's not a logical thing, it's a nervous system thing.
Yeah, it's an adaptive survival, right? Stay
Right,
safe. So,
right.
I think you saw me roll your eyes because I'm almost getting burnt out on that phrase a little bit, because
I
I was like
understand.
it's not I believe that, yes, nervous system regulation, but again, being a brain spotter, I'm like, if we're constantly having to regulate our nervous system, something is unhealed, right? Like,
Right,
we really need to
right.
be talking about this nervous system healing. Like,
Yes,
we
I
should
like that.
make our nervous system, I don't know, we forget this, is like it's a self-governing system, just like all
Right,
the rest of our
right.
systems. Like, we really should never have to pay attention to it.
Mhm.
It regulates its own self. So if it's drawing our attention to it, it's because something is not okay.
Right,
And
right.
so if we're constantly having to regulate, like
That
it's
means that there's imprints in there that need to be cleared out. Yes.
yeah, that need to
Yeah,
be healed.
yeah.
Then it should go back to doing its job. And we should only have to pay attention to it when there's
Right.
actually a threat in front of us.
Right. Well, too bad we're not the antelopes on the Serengeti where we just shake it off and then everything's fine. But we don't do that as human beings because when our bodies shake or our muscles tremble, we're like, what's wrong with me? Right? Instead of knowing that, and again, this is probably where your class comes in, knowing that that is a natural response to healing.
Hmm. Yeah,
Mhm.
natural and necessary. Right? And
Right.
and you just, you look at the world differently. Like, I just recently had surgery, and they're coming out and they're trying to make you really comfortable and give you all these drugs. And I'm like, I need my system to be able to decide whether it needs this pain, like, if it can regulate it its own self before I start adding things into it, because otherwise I will keep it from doing its job. And I get these looks from the nurses like,
What are you talking about? Yeah.
"What are you talking about?" I'm like, "No, I don't want your warming blanket just yet because my body needs to shake off this anesthesia." And they're like,
Uh-huh.
and I'm like, "But it has to happen. And if we,
Right.
if we truncate those natural
It gets
processes,
stuck in there.
it gets stuck." Yeah,
Yeah.
but they looked at me
Right.
like, "What what are
Right.
you talking about?"
Right.
I'm like, "Well."
Well, I mean, that's another area. I think ERs and doctors and so forth, they might say they're trauma informed, but these are some of those simple things that they may not understand about neurobiology and how it works and how the body heals itself.
Right, how the body kills itself. And so
Mhm.
that was one of the things I think that we have. SAMHSA actually has done all of this great work. I didn't know about it until I started researching for this class,
Mhm.
that
Mhm.
SAMHSA has 8 steps in a trauma informed practice.
Mhm.
One, starting with trauma awareness, going all the way down to a trauma informed. And the last step in that is using a modality. Right. So there's all these other steps that need to be in place in terms of safety, understanding responses and reactions,
Mhm.
and then the last one is using our modalities, which I thought was very fascinating. And
Mhm.
then APA, and you know 12 years ago, published 12 core competencies for trauma informed care. So these are the 10 core competencies that psychologists should possess in order to treat trauma.
Mhm.
And I'm like, wow, I didn't even know that these standards existed until I started
Mhm.
researching it.
Mhm.
So,
I just
yeah.
wonder, in those standards that you were looking at, did they talk about the body?
Mhm.
Well,
Yes.
that's
So
good.
they did. They talked about the body. So, so a fundamental understanding of the biology, physiology, neurology of trauma, trauma responses, trauma reactions. Yeah.
Mhm.
So that's actually what my trauma literacies, those core trauma literacies, are taken from those 10 standards.
Mhm.
Mm.
Mhm. Okay.
So yeah, advanced for advanced for the day to 2014. I'm like, wow.
Mhm. So, what do you find are some of your challenges in bringing this workshop out to folks?
Well, the biggest challenge, Sri, is that people want to pay for techniques and they don't necessarily want to pay for knowledge.
Mhm.
I think that's what I is one of the biggest challenges, or
Yes.
the presupposition that because they've learned EMDR, brain spotting, IFS, somatic experiencing, that they
Yeah.
know about trauma. So
Yeah.
they don't, yeah. So we just don't see our own gaps in training. So
Right.
yeah, this
No,
is
that makes a lot of sense. I mean, I come across that too when I teach brain spotting in parts. A lot of folks are like, "Well, what do I do when this happens?" And it's like, it doesn't work that way.
right,
Yeah.
right. Yeah. And I've really seen that shift. Again, we've been doing this for a while, right?
Yes.
When
Yeah.
I started, and I'm sure when you started, we were generalists, right? Nobody
Right.
specialized in anything. We just worked with whatever showed up in the office.
Mhm.
So
Mhm.
now with this niching, right, specialization, I think we're missing some of that whole body, whole person approach.
Mhm.
That
Mhm.
makes sense, right? Like,
Yeah. Yeah.
how do I treat depression instead of I have a human being sitting in front of me
Right.
with depression? How do I help them?
Right. Well, that's
And
attunement. I mean,
mhm,
talking about attunement, and I think that is missing quite often. And you can teach it to a certain extent, but it also, what's really big, I think, is the presence, like you were saying, the presence of the healer, the coach, the therapist. That is the
yeah,
core of it.
that is the core of it. And that is why I developed the Aura framework, is
Mhm.
it focuses more on that part. So here's your trauma foundation, the knowledge piece, right? The information piece. And then the second part, which is one of the core competencies, is clinician presence.
Mhm.
Regardless of modality, you know that therapeutic relationship is the most influential factor in
Mhm.
positive outcomes. And so really helping clinicians understand that attunement isn't just sitting there and listening non-judgmentally.
Mm-hmm.
It is lending that neurobiological support, right?
Mm-hmm.
Can you see, can you tell, like, can you make adjustments based on what you're witnessing?
Mm-hmm. Mm-hmm.
Mhm.
Yeah, because I mean, I talk about this a lot too. I'm really hearing what you're saying, Melanie, in that when we sit in presence, that client's neurobiology syncs up with our neurobiology. We are the grounding force, and that
Yeah,
helps them be able to go where they need to go.
yeah.
Mm-hmm.
And I think in brain spotting and really in any with our clients, so we actually are managing 3 nervous systems. It's the client's nervous system, our nervous system, and the nervous system that is happening between the 2 of us, right?
Right.
So
Mm-hmm.
there's 3 dynamic factors, um,
Mm-hmm.
that are being managed. And so the Aura framework really is not another technique or another tool. It really is a clinician focused. Let me invest in you. How can we help you stay grounded, regulated? Know where your window of tolerance is, right? Like
Mm-hmm.
therapists also have a window of tolerance that can be
Absolutely.
right activated. And
Yeah.
how do you pay attention to your own self so that you can stay present and attuned and
Mm-hmm.
resonate without
Mm-hmm.
without you being outside of your window of tolerance and
Right.
without you,
Right.
right? And that's it isn't a skill, it is, but it is something I think we miss because we're so again focused on safety just means you can come in and talk about whatever's going on without being judged. And I'm like, it
Yeah.
goes a lot deeper than that.
Oh, yeah. I mean, I'm just thinking about I was talking to some new clinicians recently, and, like, they don't have choices about what clients they get. Like, they're just meant their agencies that they work at are like, here's who you're working with." And
Mhm.
they're like, "Well, what do I do if what they're giving me is outside my window of tolerance? I've tried to go." And we talk about, well, if this is, not in your scope of practice, refer out. We talk about like these black and white ethics, but then we work for agencies that are like, well, here's your client. Like, I'm telling you, this is the client. So a lot of clinicians don't feel like they feel empowered to make choices, um, you know, to be aware of their own window of tolerance.
Yeah. Yeah. And then learning that that is a skill that we
Yeah.
need to work on, not just a technique to how do we expand our own window of tolerance, right? And
Mhm.
that goes back to, I really didn't start doing trauma work until like 2016. So it's just been about 10 years. And
Mhm.
before that, I was like, I don't even want to work with trauma. That stuff's scary, right? Like I'm
Mhm.
like, I don't want to sit there and talk about that stuff all day. I didn't want to do that. And so I really had to learn to be a trauma therapist because my clients demanded it, right? Like
Right.
they needed me to do this work. And but we don't have trainings on how do we learn how to expand our window of tolerance. And
Mhm.
I talk about this in this workshop too, is that a significant amount of healers are people pleasers, right? We
Mhm.
grew up regulating other people's nervous systems.
Mhm.
And so when our clients get dysregulated, we feel like we're doing something wrong or it's we had to fix it or that was I did that. I made that worse for them. And we're
Mhm.
not even aware that that's what's going on inside of us, right?
Right. Right.
That it's like, oh, that's actually me.
Yeah.
I'm distressed. I'm outside of my window of tolerance.
Right.
My client's fine. I'm I'm the one
Well,
that's
and
uncomfortable.
I mean, we get these double messages too, because when you're in grad school, they're telling you it's not your job to fix the client. And then you get into an agency and it's like, okay, you've got 6 sessions and you need to decrease anxiety by 60% in 6 sessions. So it's like
Right.
it's this double whammy, right? There's
Yeah.
so much
It,
inconsistency.
yes. Yes, there is. Yeah, there is. I when I teach the ethics classes, we talk about competencies and what we need to do, to be actually competent when we use the term trauma informed, right? Like what does that actually look like? What does that mean? And I'm like, this dates me, but we get out of grad school. Yeah, you sit with your first handful of clients and you realize, like, oh, I didn't actually learn anything about treating anxiety. And so, we used to run to the filing cabinet and look for worksheets, and so it's like, oh, and here's a protocol, and here's how you can do this. And I'm like,
Mhm.
yeah, wait, I didn't learn how to. do any of that. And so
Be with it. Be with it.
you with it.
Sit with it. Yeah.
Sit with it. Yeah, and then so much I notice as I work with interns and when they become licensed, it's that license, they feel like they need to be so much more competent than they were 3 weeks ago before they got their license. Like, you still have the same skill set. Your
Mhm.
license, yeah. But yes,
It
so
comes
much
from practice. It comes from
yeah.
practice and presence and all of that. It's like building that internal muscle, like you said, of expanding our own capacity over time. Um, yeah. So does the class talk about how to have that separation too so that they don't take on the
Mhm.
trauma of the client?
Yeah.
Mhm.
So I really try to focus again, like this part is for the clinician. Like this is where I invest in you to help you
Mhm.
be what you wanted to be in the first place, right? Like nobody got into this profession to treat anybody. We got in the profession to help people. And
Right.
David talks about that dual attunement with the client, but we actually also have to be paying attention to what's happening inside of us. So, yes, so focusing on can you, again, hold space in the change of your client, but also be paying attention what is happening in your body?
Mhm.
What are your thoughts? What's pressure? Like, where are you getting activated? Are you sitting there going, oh my gosh, I need to help this person. I need to help this person. And feeling your own anxiety and
Mhm.
being able to manage it and regulate it in real time,
Right.
right? And then also, I really emphasize this idea of compassion. Like, I think
Mhm.
A.U.R.A is when it talks about you are a compassionate witness.
Yes. Yeah.
And compassion really helps us stay separate,
Yes.
right? I'm here with you as a witness, but I am not in it with you. If I get
Yeah.
in it with you, nobody's helping anybody,
Yes.
right?
And I totally get that. There's a lot of research out of Germany around compassion. Olga Klemenke, and then I can't remember the other Singer is the other last name, and they talk about this very much about being able to teach even compassion so
Mhm.
that there is that differentiation that you're talking about. So
Yeah.
important.
Yeah.
Because
Yeah.
otherwise our pain centers in our brains light up because we go into the pain with the client if we don't have
Mhm.
that separation. So I hear you on that one. That's so important so that we can do this work. Yeah.
So that we can do this work. I
Mhm.
think compassion also helps us to stop focusing on I am treating a diagnosis or a
Yeah,
presentation
yeah,
or trying to reduce symptoms. And that again, like technique driven. And
right,
so I think that compassion allows us to stay out of the weeds. I think sometimes of the trauma work, right? Like the weeds of,
right.
oh, I've got to tell this person they have to be able to tell their whole story, or I need to fix this for them, or I need to
Yeah,
I think again subconsciously we keep thinking we have to undo the events, right? Like
yeah,
I'm like, we can't undo the event.
no.
Yeah. We
Well,
have to
and
do
the other thing that's coming up as you're talking is how many, and I see this so often in new clinicians too, they're attached to that outcome. And
Mhm.
it's like, well, clients are gonna come and clients are gonna go, and if you're attached to that outcome, like if your client leaves, what's that gonna do to your central nervous system if you're attached to that outcome?
Yeah. And again, that the outcome is hinged on you, that becomes
Right.
performance-based therapy, right? Like
Yes.
in order for me to feel capable and competent, my clients owe me a certain outcome. They have to get better or they can't be struggling. And again, our clients can feel all of that,
Mhm.
right?
Mhm.
When I'm working with consultees, often, again, we have this desire, like, oh my gosh, I have this great thing and I want my clients to experience this. I want them to get relief. And I'm like, you do know that neurobiologically you're putting pressure on your clients to perform for you.
Mhm.
Like it's your want, it's your desire. Of course,
Yeah.
we want those things that if we are feeling that strongly inside of ourselves, our
Right.
client, they pick that up, right?
Yeah.
We
They'll pick
can,
up that we have an agenda and they go into
mhm.
compliance. Absolutely.
Yes, absolutely.
Yeah.
Yes, yes. There's this book called The History of Intelligence. It's not even a therapy book, it's just the history of intelligence. But it talks about how we can feel people's intent towards us,
Right.
right? And
Absolutely.
that's part of attunement and
Yeah.
presence and compassion. So
Yeah.
yeah, I'm like,
Yeah.
yeah,
So, is
we
there
don't.
anything that I haven't asked you that would be important for our listeners to know about your class? Any other shares that you think would be important to highlight so that they know about this wonderful class? And my hope is that, anyone that can be with a beginner's mind will consider taking it so that they have a really good foundation. Because I think, like you said, I think they'd be surprised at how much they probably don't know if they were just pushed right out of grad school and into I mean, I've had therapists that have come to me who have been in the field 15 years and have never done their own personal work, and they're shocked to recognize the neurobiology piece as well. So I don't want it to come across that this is just for newbies.
No, no,
Yeah.
exactly. It's for anybody. And
Right.
I'll illustrate this. I've been assisting with brain spotting phase 1 and phase 2 trainings now since 2020. So it's been a
Mhm.
few years. And as I'm sitting and I'm watching and observing, these are the things that our newer clinicians struggle with, right? They get surprised when they go into their first practicum. They get surprised that their activation, they didn't
Right.
get right. So both as the when they're the client and when they're the practitioner, and
Yeah.
they don't know what to do with it, and it gets overwhelming for them. And
Mhm.
so I would say this class really is about knowledge helps us with uncertainty, which sounds really counterintuitive, right? But knowledge is not to be like, I know exactly what's happening, but it helps with clarity. Oh, I
Yeah.
know why that client system is getting activated right now.
Mhm.
Right. So it's it's helps with capacity as well. So it
Well, it
helps with
normalizes.
yeah. So it
Yeah.
normalizes it.
Yeah.
So that really is I watch and I've watched and and the questions that come up in the phase 1 and phase 2. And so I really developed this workshop to help answer some of those questions
Yeah.
so that they are feeling more they can expand their capacity to sit with whatever's in front of them because
Mhm.
they have a better foundation of understanding what they're witnessing, what
Yes.
they're experiencing, what's happening in front of them.
Yeah.
Not so that we can lead with certainty, but we can just lead with clarity.
Right.
Right.
Well, and I would recommend this to therapists, coaches, psychologists, because even coaches, so that they can really learn to identify when it goes out of their scope of practice. When you're going into more consistent trauma territory versus working on a goal or something like that. So this workshop can be for any of those folks that work with people that are wanting to achieve or wanting to heal. Like, um, it'd be good
Yeah.
information.
Yeah. Basically, it's like grad school 101. This should be the very first class we ever learn in grad school before we ever learn anything else,
Yeah.
which is what is happening with our clients and how can we stick with what we are seeing because we now have a foundational understanding of what trauma actually looks like in real time and then how using the neuroexperiential model and these body-based approaches why they're so important and why they're so
Mhm.
effective. So that
Yeah.
really is the course in a nutshell.
Yeah. Well, thank you. Thank you so much for coming and talking to us and unpacking it for us. And we'll make sure that everybody has links so that they can reach out to you and learn more about the course.
Sounds good. Thank you so much for having me. It was good to see
Yeah.
you. Good to chat.
Good to see you too.